Hey guys, welcome back for our daily practice questions. As always, I like to get into my introduction and disclaimer before starting on our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, 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 you guys. I'm Dr. Brittany Weinstock, and I'm a family nurse practitioner, and I'm the founder and CEO of the Nursing Studio. I provide resources, tools, courses, and videos to assist nurses as well as nurse practitioners with success on boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with a 99% pass rate on our comprehensive reviews and a 100% pass rate on our one-on-one sessions. Now, I always like to get into the disclaimer and reminder that there's no absolutes in medicine, right? So we treat on a patient by patient basis, and any of the questions that I provide are created by myself based off of the current guidelines that are being tested on the ANCC as well as AANP exam. Now, with that being said, when I do videos, teach on things that we currently do in practice, I will always include that so there's no confusion, okay? All right, you guys, let's get into question number one for today. All right, so question number one states, a patient presents to the office today with complaints of pain and a rash to the left side of her abdomen that leads to her back. Upon examination, the nurse practitioner notes vesicles following a dermatomal pattern to the outer aspect of the patient's abdomen. Based on this presentation, what is the best differential diagnosis? Is it A, scabies, B, hidradenitis suppurativa, C, shingles, or D, roseola? Take a moment and tell me what you got in the comments. All right, you guys, so I always recommend reading the stem of the question first to allow yourself to slow down and ensure that you're answering what is truly being asked of you, right? So here the stem of this question states, based on this presentation, what is the best differential diagnosis, right? All right, so I always say if they're asking about a diagnosis, you need to run it back and see what the assessment findings provide for us to even be able to determine our differentials, right? So here this patient comes in with complaints of pain to the left side of her abdomen that leads to her back. She also says there's a rash there. Upon exam, the nurse practitioner notes vesicles following the dermatomal pattern. When I say this, you say that, right? This is one of those things, those key identifiers that you hear me talking about. So when I say vesicles that follow a dermatomal pattern, you should say shingles, you guys. So the best differential diagnosis here is C, shingles. All right, question number two for today. The nurse practitioner has diagnosed the patient with H. pylori. The patient has a history of penicillin allergy. How should the nurse practitioner treat? Is it A, with triple therapy, the clarithromycin, omeprazole, and amoxicillin? Is it B, triple therapy with clarithromycin, azithromycin, and omeprazole? Is it C, the quad therapy with the bismuth, flagyl, doxycycline, and omeprazole? Or D, do the triple therapy with ciprofloxacin, amoxicillin, and omeprazole? Tell me what you got in the comments, you guys. Tell me what you got. Tell me what you got. All right, so stem of the question states, how should the nurse practitioner treat? Same thing. If they're asking for a treatment, we run it back to see what the diagnosis is. If the diagnosis is not provided in the question, then you need to take it a step further, review the assessment findings so that you can come up with your differential diagnosis to know how to treat, right? So here the diagnosis is provided. They tell you the nurse practitioner has already diagnosed them with H. pylori, right? So how do we treat? So this patient has a penicillin allergy. We do know with H. pylori, however you say it. Okay, that's about all right. We know there's triple therapy and there's quad therapy, right? So what we go with A, the triple therapy of clarithromycin, omeprazole, and amoxicillin. Well, we know we won't take that route of triple therapy because amoxicillin is a penicillin and may have a penicillin allergy, right? So you could take A out. B was triple therapy of clarithromycin, azithromycin, and omeprazole. No, you can take that one out as well because that's not the triple therapy. Remember, I say think we're putting a cap on this bug for H. pylori with triple therapy. We're using clarithromycin, amoxicillin. So C for clarithromycin, A for amoxicillin, and P for PPI. So whatever PPI, they typically do like what they call the Prev pack, Prevozit. So omeprazole, you know the PPIs end in zol, so make sure you pay attention to those. But CAP, so clarithromycin, amoxicillin, and a PPI. Now, if you got stuck there because that is CAP for that option on B, clarithromycin and azithromycin are in the same drug class, right? Those are macrolides, so you should have known. No, we're gonna take that out because we're not doing double of the same drug class in here. We're attacking this bug from different antibiotic and antifungal treatment options, right? All right, would you go C with the quad therapy with bismuth, flagyl, doxy, and omeprazole? We'll hold it because that sounds about right. Or would you do triple therapy, D, ciprofloxacin, amoxicillin, and omeprazole? No, again, you know they have a penicillin allergy, so we're not going amoxicillin, and Cipro is not utilized in triple therapy. So your best answer is C, the quad therapy. Remember, with quad therapy, we do bismuth, we do flagyl, we do a tetracycline, so most commonly like doxy, and a PPI, so omeprazole, right? And I commonly get the question on which to use. So I gave this type of scenario because it's really a preference. You know, it's a bunch of medicines. You already have GI upset, and these antibiotics can, tear your stomach up too. And so some people want to take less medicines. It's kind of a preference in some situations. Some things we're trying to attack from a different perspective. But for here, it's also an example when there's an allergy, then we want to go the alternate route, right? So see, this is why we went the quad therapy here, okay? All right, and lastly, question number 3 for today states the nurse practitioner has diagnosed the patient with acute pyelonephritis. The patient has a history of a fluoroquinolone and sulfa allergy. How should the nurse practitioner treat? Is it A, augmentin, B, ciprofloxacin, C, levofloxacin, or D, Bactrim? Take a moment and tell me what you have in the comments. All right, you guys. So similar question states, how should the nurse practitioner treat? So same scenario. When we have a question on how should we treat, we run it back and figure out what the diagnosis is. And if there's not a provided diagnosis, we take it a step further and look at the assessment findings to come up with our diagnosis, right? So here they have told us the diagnosis is acute pyelonephritis. So you need to quickly think of how do you treat acute pyelonephritis? Well, acute pyelonephritis we know is commonly treated with ciprofloxacin is one option, right? But they have a fluoroquinolone allergy. So you can take B and C out of there, right? That floxacin is a fluoroquinolone, right? Levofloxacin, more specifically, is a respiratory fluoroquinolone. Will we go A, augmentin? Yes, augmentin is another option for treatment for ciprofloxacin. So your best answer is A, augmentin. And if you were even in doubt, you should have been able to eliminate D, Bactrim also because the patient also has a sulfa allergy. Okay, so don't let yourself miss questions when they're giving you key things to eliminate like allergies. Don't you skim across these allergies. If you got to write it to the side, if you need to highlight it on the exam, do whatever you need to do that you're not skimming across or rushing through and missing key things to get you to your answer, okay? All right, you guys, I hope you found this helpful. As always, be sure to like, comment, and subscribe and share with whomever you may think may find this beneficial as well. You guys, happy Nurses Week, okay? Happy Nurses Week, y'all. Thank you for all that you do. This is an amazing community to be a part of, to work in, and May is all of the things for me. May is my birthday. May we have Nurses Week. I teach too, so you can kind of say a little bit of Teachers Week, but I'm not a teacher anymore. And Mother's Day is coming, so lots of love in May, right? But y'all know when I celebrate with you guys as well. I appreciate all of the happy birthdays, and I told y'all on my birthday video that I was going to be drawing a name, so I will be posting that shortly because I do have a drawing winner. But this week I will also be doing some things fun to thank y'all, show appreciation to the nurses, especially my subscribers. So be on the lookout. This may be your lucky week, right? So y'all just stay tuned. you know what to do. Make sure you meet me back here. But if you need any of our resources from the Nursing Studio review book, either the ebook or the paperback, both are linked in the bio of this channel. If you need our review courses, our 5-week review course is open. Enrollment is closing soon because we're almost maxed with enrollment. But that class starts June the 10th. And then there's a self-paced course that you can do at your own pace, videos of me teaching with my mnemonics, and it's just like how I do on here, based on system by system. And that one is designed for our FNP and our AGNP reviewers preparing for both exams, ANCC as well as AANP. It specifically also has a non-clinical system in there as well, with many quizzes with each of those. And also our other option is our one-on-one sessions. Our one-on-one sessions are based upon your needs. So if you specifically have a weakness and you're just like, hey, Brittany, I really just struggle with this and can't get this area down. I just need a session to help, for you to help me to get this together, then that's an option. And then our bigger option that is more commonly utilized is the custom package. So some people are like, hey, I'm testing in a week. I just want you to check my exam readiness. Some people are like, hey, I need just a 2-week review to tie it all together before I go in here and test. And then some people are like, hey, I was unsuccessful previously. I don't know what to do next. I'm tapped out, burnt out. I've done all the studying. I just really don't know what to do, and I want to test again in X amount of time. And so then we gauge where you are, give you structure, take those weaknesses and make those strengths. And we do all of these things within your timeline to take you from being unsuccessful to successful. So if you're looking for any of those options, reach out to the Nursing Studio. I would love to work with you guys. Telephone number is 803 400 6864. Call or text that number, or you can shoot us an email at the nursing studio, the number one, at gmail.com. But as always, make sure y'all meet me back here. Happy studying. Bye, y'all.